Hi, good afternoon again, here on another weekly video. I'm going to start giving you practical advice. This video is about starting to give you practical advice on what to do, on what treatments we do here, and how you can maybe implement them at home. Obviously, here at the hospital we have all the latest technology, but at home definitely you can do things if you're going through cancer to help your immune system. So I'm gonna start talking to you about the different treatments that we do here, and then I'll give you some advice at home. For example, today I want to talk about hyperthermia, different modalities of hyperthermia, what you can expect, and how we do it here, and how you can probably try to do something like that at home. Whole body hyperthermia, it's a therapy, and local hyperthermia, it's a treatment that consists on increasing body temperature to around 104 and maintaining it there for probably around from 45 to probably 120 minutes, and it can go longer, depends a lot on what you can tolerate or what the objectives are. For anti-cancer purposes, probably 1-2 hours should be enough, maintaining temperatures of about 104 Fahrenheit. Local hyperthermia, it's another modality of this treatment where we want to increase the intratumoral temperature to around 104. For that we use different devices. There is the Oncotherm, there is different devices that are used. Obviously these devices are very specific, and because they need to have certain a good penetration in tissues, so sometimes you can reach deep tumors. The idea or the fact behind it is that cancer cells do not tolerate temperatures above 104 Fahrenheit. A normal cell will tolerate temperatures up to 120 degrees Fahrenheit, so there will be no damage to normal cells, while cancer cells will be destroyed. At the same time, these will destroy cancer cells, but also weaken cancer cells as well. So you can use other treatments to make it better. Actually, hyperthermia sometimes is used in combination with radiation in certain situations. Here, the idea, we do the whole body hyperthermia. You're doing it with a nurse, because obviously maintaining such temperatures, first it will cause an immune response. Like when you're having a fever, the body will respond by increasing temperature, and this is with the objective of destroying bacteria. In this case, we're increasing body temperature to destroy cancer cells. But you have to be careful, because obviously if you stay in the with such elevated body temperatures, things can happen, complications can happen. So here there's a nurse with you all the time that is checking blood pressure, oxygen levels, hydration. So all of those aspects of doing whole body hyperthermia are important. The local hyperthermia is as long as you have the devices and you're comfortably in a good position where the tumors can be reached. Usually the time for these local hyperthermia, where we locally hit the tumors, usually we need to do these for about 45-60 minutes. Obviously depends a lot on what we're doing and the area that we want to reach. These treatments are safe, doing it correctly. At home, for example, you can do sauna, you can do different, but just to make sure that your just to make sure that your body temperature reaches 104, that you don't stay, for example, too long, and if you feel dizzy, you need to come out. But that's something probably that you can do at home. Obviously here we do it more intensely. We do it with all the devices and chambers that are recommended. For whole body hyperthermia, we have the latest technology here. It's a chamber with radiant heat. For local hyperthermia, we use different types of heat. We use short term, we use far infrared, we use laser. So we use different ways of increasing intratumoral temperatures. This is a way that also you'll stimulate your immune system in general. It's a safe and non-toxic way of destroying cancer tissue. So there's a lot of treatments that we do here as well in combination with this one. I will weekly explain one therapy at a time, and tell your friends or people that you know that are going through cancer, and tell them that please in the comments ask me questions. I will answer them. I'm sure it's a way to communicate with you. Make sure to tell also to subscribe, because well, we want to have well, for the message to get out that we're doing this, and the objective is to share information with you that can help a lot of people. And also here at the hospital, we're doing very good treatments, but primarily is sharing the information. That's what we want. All right, well, thanks a lot, and I will see you next week. Thank you.